Okay, so today I'm on solution-focused therapy. So the way of being for SFT, just in general, the counselor should be collaborative, should try to take a team approach with the client, mostly be a consultant who's supposed to learn how the client views their issues. The client should be equal to the counselor, and they're considered the expert on their problem. And then the overall role of the therapeutic relationship is just a collaborative one designed to empower the client and help them use their own strengths and establish methods of healing and just try to identify the solution to their problem. However, it's important to bring up there are kind of some different client and counselor roles in SFT. There's the client and a visitor relationship, and this is where the client's more disengaged and doesn't actually want anything from the process, like an involuntary client. And in this case, the counselor should adopt the role of really complementary to the client and trying to just motivate them to return to counseling. Then there's the client and a complainant relationship, and that's when the counselor and the client have kind of identified the problem, but the client's really not aware of their role in the problem, and they're really not looking at identifying exceptions to the problem or trying to focus on the solution, really. A client who just reports, say, being unable to form intimate relationships but ignores the ones that they do have and kind of just focuses on, oh, I'm never going to be able to get close to anyone. Okay, and that's pretty much that relationship. The client and a customer relationship, that's kind of the ideal one. That's when the counselor and client have worked together to describe and identify the problem. The client acknowledges their role in the problem and is really working and focused on how to solve it. The client's motivated, just having difficulty with their goals, and that's where the counselor helps them. And so that last one's kind of what the therapeutic relationship should strive to be and what the client should strive to be. That's just those different levels in SFT. The way of understanding for solution-focused therapy, the key concepts, well, first of all, the different types of client-counselor relationships are some of the key concepts, so I'm going to segue into this section. There's also the concepts of solution building over problem solving, and that's just the idea of focusing on client strengths and resources and what they've done right in the past instead of focusing on their problem. Then there's the idea of focusing on mental health over pathology, and that's, again, focusing on what is right with the client, like their abilities and strengths, rather than their actual problem and trying to find a diagnosis. Then there's the idea of simplicity and parsimony, which is the belief that the best answer to a problem is the simple and direct, less complicated answer. There's the concept of problem-free talk, which is just focusing on positive things in a session and avoiding discussing the problem. There's also the idea, the change is inevitable and problems change idea, which is just that problems aren't really omnipresent, but they come and go and increase and decrease in severity, and so that someone should really just focus on the times when a problem does not exist and those elements that make the problem not exist or make the problem decrease in intensity. Another key concept is present and future time orientation. That's the idea that therapy should be focusing on the future and on client goals, and the past really should just be neglected except for looking for past solutions and exceptions to the problem. There's also the concept of focusing on what works, and that's just really just honing in on what's working for the client and not changing the things that are working. Then finally, there's a concept that big problems may require only small changes, and this is the idea that any small change can have a domino effect, causing many more changes and ultimately possibly eliminating the problem. Now, SFT's view of human nature, their opinion is that for the most part people are healthy and able to solve their own problems, and that most people want to make positive changes and have the ability to do so. Other elements of their view on human nature, reality is subjective. We're all unique and different and have different experiences, and they also really don't believe that personality exists. It's a man-made concept. There's no personality framework. SFT's view on maladaptive behavior is really interesting because the theory doesn't really focus on it or talk about it much. Just kind of the sense I was getting is that they really view any negativity as maladaptive behavior. So like negative thoughts, negative self-talk, even just talking about the problem instead of looking at the solution is a maladaptive behavior. Then on the other hand, healthy behavior, that's being able to come up with solutions to problems, focusing on positive aspects rather than negative. And I kind of just want to say too, given the general nature of this theory, I think really that their default view on healthy behavior is that every behavior is healthy in some way. Just, I don't know, the optimistic outlook of this theory. SFT's goals, they really vary based on the type of client-counselor relationship. Like a lot of times if they're the visitor, the goal is just to get them invested in coming back. If they're a complainant, the goal is to get them to recognize their role in their problems and look for finding a solution. And if they're a customer, it's working on finding that solution. So that's really the goals just differ on the stage. Their view of therapeutic change, how change occurs, they believe there's 5 main steps. First, you describe the problem, then you establish goals, then you look at any exceptions to the problem, then the counselor gives feedback, and then both the counselor and client evaluate the progress. SFT believes that therapeutic change can occur very quickly, sometimes even in one session. And really, the change is all about just clients realizing their role in the problem and how they can be a role in the solution. Sometimes change occurs when clients use old solutions to solve their current problem. Sometimes even clients just need to figure out the steps they have to take or how they can solve their problem, and then they don't even necessarily need therapy anymore. The ways of intervening for SFT, a lot of different techniques here. There's the do something different task, and this is just a homework assignment where the therapist asks the client to do something different in relation to the problem. It doesn't matter how irrelevant or wild it might seem, and this tends to put the focus on the clients and their strengths and resources. Then there's the formula first session task, which is when a therapist instructs a client that the next time the problem arises to note any details that indicate that the problem can be solved. And this helps increase client responsibility and kind of focusing on the solution instead of the problem. There's the miracle questions. It's based off Adler's The Question and Push Button technique. It's just where clients imagine that all their problems have disappeared, and then the counselor has them describe what's changed and really how they would notice it. It helps them sort of conceptualize their problem and the goals. Another big technique is looking for previous solutions, which is just having the client look at how they've solved past problems. A lot of times there will be similarities in problems, and a past solution might work for a current problem. Complimenting is a technique. The counselor will compliment the client to reinforce positive behaviors and build the therapeutic relationship, and also to try to get the client to start doing positive self-talk. There's looking for exceptions to problems, and that's just having the client list out exceptions to a problem just to prove that the problem's not absolute or omnipotent. There's scaling questions, and that's just having the clients rate their problems on a scale of 1 to 10, and then looking at what they can do to change that ranking, kind of focusing on baby steps, changing it from a 1 to a 2. There's coping questions. That's asking clients about their current coping methods in order to take the focus off the negative symptoms and focus on the positive aspects about what they're doing right. Helps minimize the power that the problem has and helps the client build confidence. There's normalizing. That's discussing with clients how their problems compare to normal people's problems, or maybe how common their problems are. And a lot of times this can help the client give less power to their problem. There's noticing, and that is just identifying the parts of speech that a client uses which relate to a solution, and then honing in on those to get the client to focus on moving toward a solution, kind of to get the conversation on that level. There's the continuation question, which is having a client make observations about their life and the things they want to continue happening. So again, taking that positive focus and moving that forward. There's the overcoming the urge task, which is having a client make observations about just what happens whenever they overcome the urge to give in to their symptoms or problem. So focusing on the problem, or focusing on the solution, kind of our current theme here. There's returning the focus to the client, which is whenever client's trying to blame somebody else or blame an outside factor, just discussing with the client their part in the problem and focusing on the controllable elements in order to empower them. And finally, there's stability as change, which is just emphasizing to the client that stability is positive and actually requires strengths and skills, and plateauing shouldn't be considered a bad thing.